So I'm now going to switch gears a little bit here. If I can get this thing off my screen. To talk about vocational, give you a bit of a vocational overview in terms of something that you can kind of grab onto and hope that will allow you to kind of conceptualize vocational assessments, where they stand in relation to one another, what to use when, how do you put the kind of the whole package or basket together. This is more for the own occupation, so the pre-post 104 week, the essential job tasks. Okay, so we start with an injury or illness. For purposes here, we're really talking about an injury stemming from a motor vehicle accident. Could arguably also occur through slip or fall or some other, type of litigation causation. And from the impairment or injury stems three basic categories of impairments or symptoms. Those being the physical impairments, diagnoses, the emotional or psychological, as well as the cognitive impairments and or diagnoses. So I think all of you know basically how to assess these. This is no secret. The physical ones, you just find related specialists in those specific areas. Emotional, behavioral, or the psychological and psychiatric assessments. And the cognitive tend to be most typically through neuropsychological evaluation or a kind of a broader cognitive evaluation without it being really neuro in orientation. Okay. So if we want to go from there, we know what the impairments are, and ultimately we need to ask the question, can the client perform his or her essential job tasks? So obviously we need to understand what the individual's job demands are. So all of you are familiar with a PDA, a physical demands analysis, right? I can assume that, everyone's familiar with that. But what you're probably much less familiar with, because again it's quite unique, there are some firms beginning to offer it. We've offered these now for about 6 or 7 years, so for quite some time. That includes a emotional psychological demands analysis and a cognitive demands analysis. So whereby the OT still goes into the workplace and does the physical, if that's relevant. If it's a sedentary job, though, obviously it's not going to be particularly relevant at all. To look at the emotional, psychological, emotional, meaning the interpersonal aspects of the job, how stressful is the job, what's the reaction time going to be? In other words, somebody have to be able to keep their wits about them to deal with an emergency kind of situation. And obviously the cognitive demands, and we certainly know that the economy within Ontario has certainly moved closer and closer to being, not exclusively, but much more to a service-based and information economy where the demands are very much cognitive, and as well as emotional, psychosocial. Emotional, psychosocial also deals with, these days people are having to work in teams, working with other people, moving in and out of different kinds of projects. So the interpersonal communication, and being able to do that well, is also a key facet of the job. So then what's basically missing is the link. What moves between the physical impairments, for example, and the physical demands of the job. And so on the physical side, you're all familiar with a functional ability evaluation, also known as FCC, right? Folks are familiar with that? Has anybody seen anything comparable to measure the emotional, behavioral, or the cognitive? Offhand? No? So it's still not very widely known. So we have developed the cognitive psychological functional ability evaluation, which includes basically a core psychological disability assessment, but also very specific functional types of evaluation that we're using to interpret in that light. On the cognitive side, neuropsychological assessment is fine in the brain injury cases, but what about those cases? Let me ask you, so how often do you come across cases where the client has not had a brain injury? There's no indication the Glasgow Coma Scale was 15, never unconscious, it's not been raised the whole file, and you're comfortable with that. It just wasn't a TBI. How often in your other cases are you experiencing individual with cognitive difficulties? Is that very common?
They're always going to complain of like problems with memory. They're going to have cognitive deficits.
Right.
It's physical. It's just psychological.
Right. So are other people experiencing that same thing? It's a pretty common complaint, cognitive difficulties? Yeah, it's very common. So in that context, how do we then go from the non-traumatic brain injury, non-concussion-based cognitive difficulties to getting a sense of how a person's functioning in terms of their cognitive demands? So brain injury, yes, we use the neuropsychological, neurocognitive assessment. But in the case of non-brain injured, we consider the cognitive psychological functional ability evaluation, again, putting the individual through a host of cognitive measures, not that dissimilar from neuropsychological test battery, also using occupational aptitude testing and some other related cognitive testing to really get a good sense. And so ours basically become mirrored images. The OTs collect data that's highly relevant, highly categorized, and they have to rate it in a certain way so that we can then map on to their identification of the job demands as to whether the person's likely to meet those job demands or not. Any questions about this? Is this straightforward? Does it kind of help to tie some things together for you and kind of maybe see where some cases you've had some missing gaps, especially here if you haven't been aware of these kinds of assessments? So what's important as well, the situational work assessment, which we'll be talking a little bit more about shortly, it basically can capture all of these aspects as well. In a sense, do them even more in a more refined way than even our cognitive psychological functionality evaluation.